have a very standard setup.
Okay.
And that makes it also a bit expensive for those who would need it. But if you compare the joy that childbirth brings, the joy that families or couples have after years of being childless, then you realize that IVF is not expensive at all, or the money that is involved in it is nothing compared to the satisfaction and the joy that comes to couple.
All right. So, if you're just tuning in, this is 107.9 Orange FM, and this morning we're having a conversations with the head of the IVF, unit at Konfanochi Teaching Hospital, Dr. Charles SENAYA, and I'm intentionally starting from the angle of cost because that's what a lot of people bring the conversation to. But we used to call them test tube babies. What changed? Are they made in test tubes? And what exactly is IVF for somebody who has never heard about it before?
Nothing has actually changed. The bases are still the same. It is just that there has been a lot of advancement or improvement in the process and the procedures that we use in IVF. So you know the way natural conception occurs, normal pregnancy.
Okay.
You have a man and a woman engage in sexual intercourse and pregnancy occurs. Right. For so many reasons, which may be because due to the woman or due to the man, sometimes couples are not able to achieve this natural conception or pregnancy naturally. So one of the management options, definitely you'll be evaluated and then we'll find a cause. One of the management options is to take the woman's egg out of her body and then get the sperms from the man. You put the egg and the sperm together in the lab and form the pregnancy. Now, once the pregnancy is formed in the lab, then you take this pregnancy and transfer it back into the woman's womb. And this process is what we call the IVF. The full name is in vitro fertilization. Like you fertilize the egg with the sperms outside of the woman's body. That is doing it in the laboratory, getting the pregnancy, and then putting it back into the womb.
Sounds very scientific and very futuristic, Sounds complicated.
Yes, it is.
So, at what point in time should a couple consider IVF? Is it a decision that must be taken, quickly? But at what point in time should the couple decide that we should consider IVF?
So, it depends. Generally, we say a couple is infertile if they have been together having intercourse, unprotected intercourse, for a minimum of 1 year. But if the woman's age is more than 35 years, we reduce this 1 year to 6 months. So if a couple have been engaged in sexual intercourse and there is no pregnancy within 1 year, after 1 year, up to 1 year, and as I said, 6 months or more in those who are more than 35 years old, then we say the person is infertile. Now, when we get this couple, the advice we give that they should see the gynecologist. The gynecologist will conduct tests on the woman and then on the man. We're trying to find a cause. There are some of the causes of infertility, you just use medications and they'll be able to achieve pregnancy. There are some, for instance, if the woman's fallopian tubes are blocked or damaged, there is no way that woman can get pregnant. If the man has no sperms Either the sperm is being produced in the testes, but it's not coming out, or it's not being produced at all. There is no way that that man can impregnate a woman. So, for instance, if you have a tuberous disease and there's no way you can have a natural conception, then we advise for IVF. Now, there's one big area that is also coming up, that a couple may be fertile, all right, but because of a genetic disease, for instance, the common one we have in our area is the sickle cell disease.
Okay.
So if the man is a carrier of a sickle cell gene, the woman is a carrier of a sickle cell gene, and they are concerned that they may have a sickle cell child, or they've had one, they don't want to have another one, then we could also do IVF for them. But in that case, after taking the egg from the woman, getting the sperm, fertilizing to get the embryo, you will do a test and check whether this particular embryo, this particular pregnancy that I'm coming to transfer, have the gene or not.
Oh, okay.
So you ensure that what you are transferring has no
sickle
gene.
Oh, okay.
Okay, that's one of the big areas that is also coming up.
Wow.
And the less one that I don't like to talk about much, but it's also coming up, is they coming up that I have children. I have 4 boys, and I need a girl. Or I have 5 girls.
I want a boy.
Need a boy.
Wow.
To take over. So in that case, you also get the eggs, as I said, the same procedure. Get a sperm, fertilize it in the lab. Then you run the test. You'll be able to tell this embryo, number 1 is a male. Number 2 is a female. Number 3 is a female. Number 4 is a male. Then, if you want a male, you select the ones to start the transfer. But it has its own ethical issue. There are some jurisdictions, for instance, India, you cannot do, China, you cannot do those by law in their country. But we don't have the laws, so people still come around and then they demand it. And once they can pay for it, the fertility experts also have their own debates going on. Some people think that it's not necessary. Let's leave this to God. We are helping enough. Others think that why not? Once the technology is there, we should offer it to people who need it.
If you're just tuning in, this is 107.9 Orange FM, and we're talking in vitro fertilization, call them test tube babies, artificial pregnancy. We're talking about IVF this morning. If you have a question concerning IVF, you can send it by text or WhatsApp on 0593932993, 0593932993. This is a very important conversation about fertility that we're having, and we want to hear from you as well. So you can send a text or a voice note on 0593932993. So when people, or when a couple wait for quite a long time and they're in their late 30s and they decide to get married, is it necessarily all of them, maybe a couple are above, maybe they're both 38 years old, is it necessarily automatic that they are candidates for IVF, or they can achieve pregnancy on their own?
No, it's not automatic at all. A lot of people who marry at advanced age can still achieve natural pregnancy. They can achieve it. However, once you are more than 35 as a woman, so the example you gave, married at 37 or 38, you should peg it only up to 6 months. If after 6 months there's no pregnancy, you should seek help early, because women have a finite number of eggs, and these eggs reduce in quantity as you age, and they also reduce in quality as you age. This reduction is rapid after 35 years. That is why we peg that once you are 35, within 6 months, if you don't achieve, you should get. So when you see the fertility doctor, and as I said, you will be assessed, investigations will be done, that will decide if you have any issues or not. There's one important test that we do that tells us about the ovarian reserve, how much reserve you have.
Mm-hmm.
It is God who gives that one. Let me put it in a scientific way. It's genetic.
Okay.
So some people will have good results, even though the quality may be low. But once they have good results, they can go. That's why they see some people over 40 getting pregnant, whilst others will not achieve that. So if we realize that you are more than 38, the example you gave, and the reserve is very low, if you want to use your own egg, then we must accelerate the process of getting you pregnant. So in that wise, it tells you that for IVF, even if you are advancing age or so on, even if you are in your menopause, you can still achieve pregnancy. The only issue in that was that we have to use a donor egg or egg that the hospital will get for you. We add the husband's sperms, we get this embryo, and you can carry your own pregnancy. The only problem is that with the advanced age, above a certain age, we may not be able to use your own oocyte. But a pregnancy, yes, you will achieve it.
Conversations around fertility can sometimes get sensitive because people have their own conceptions about allowing higher powers to like moderate conception. Someone sent a message and saying that you are right because he got married in his 40s and he had to resort to IVF. So he knows how waiting too long does not help. But his question is that, does the age of the man play a role in the whole fertility conversation?
In a way, yes, but not as in women. As a man, when you age, so that above 40 years, you realize that the quality of the sperm also goes down. But, we produce millions of sperm. So most of the time, you will still be able to impregnate a woman. Even as an advanced age, some people 70 and above, you will still be able to. So it is the women that usually, once the quality and the quantity of the eggs go down, there's significant reduction in the chance of getting pregnant.
So it doesn't, the man's age
doesn't affect us as the women.
As the women.
Yes.
Okay.
That's why you see our old even at 80 they are
even at 80 they are still fathering children. But
the quality definitely reduces.
The quality of the sperm
reduces.
Reduces.
But, we produce millions, but you need only one single one. Yes, that is why for the men it is not an issue as in the women.
What would put is infertility genetic?
There are few cases, very few, insignificant cases of infertile people genetically, yes, both in men and in women. So there are some cases that are genetic. So, for instance, the man may not be able to produce the sperms genetically, but these people are very, very, very few.
Okay. Very, very few, but they still do exist.
They do exist. They do exist. And even in those cases, there is still a way out around it so that the couple can still achieve pregnancy.
Does the occupation, say, of the man or the couple affect fertility? And I'm asking because the message someone is sending is that he realizes that people who have stressful lifestyles, who have demanding work schedules, don't achieve pregnancy as quickly as those who are just free and walking around.
Yes, the occupation have an effect. We used to hear about the olden days where the long distance drivers, where the engine is under the seat. You know how the tested is outside the body because it's at a lower temperature. It needs that lower temperature to be able to function optimally. So heat, constant heat for a prolonged time can reduce the quality of sperms and lead to infertility. Stress in general can affect a lot of things, both in men and women. If the man is too stressed, even engaging in sexual intercourse is a problem. So stressed, so tired, he will not be able to have erection to even have successful coitus. But having said that, stress affects a lot of hormones that may also lead to infertility. But these ones are easily reversible. For instance, a woman, sometimes when they are so stressed, even their menstrual cycle will change. And that tells you that there will be issue or there are issues with ovulation in those months. But those ones are easily reversed once the stressful factor is taken away or eliminated. So that one is not so much of a problem. Most of the time, what you need is the counseling, and once the stress factor is reduced, you can achieve.
Is there any way you can tell if a woman is fertile or if a man is fertile? Is there any tests that somebody's listening, they are unsure, and they want to check? Is there any way to check if people are fertile?
Yes, there are ways to check. As I said, once you have 1 year or 6 months, depending on the age of the woman, of coitus without conception, you see the doctor. And there are tests that we do both for the man and then the woman. Basically, for the men, it is just the semen analysis that we do. Once we check the sperm and it is normal, that's it. For the women, we test for their tubes. Because if the fallopian tubes, every woman has 2 fallopian tubes, one womb and 2 fallopian tubes. Once the tubes are blocked, chance of pregnancy, nil. So we'll do a test for the woman to ensure that the tubes are open or are not blocked. One important thing too is to make sure that the person is ovulating. There are tests that we do to check that the woman is ovulating. If you are not ovulating, then we'll give you medication or treat the condition that is not allow you to ovulate. Once the ovulation occurs, if the tubes are fine, your womb is okay, you're able to have satisfactory coitus, and the sperms are also good, there's a high chance, not 100%, but high chance that you get pregnant. There are some few people, less than 10% of the couple, that we say that we don't know the cause. The woman is, everything is fine, the tubes are okay, the womb is okay, she's ovulating normal. The man has good quality sperms, but they are not getting pregnant. What we call the unexplained. But in that case, there are things we do and they are able to achieve.
Well, that must be very difficult. You have done all the tests, everything is fine, but you are still unable to conceive.
Yes, it is difficult in 2 perspectives. One, on the couple themselves. They'll tell you that we want to know, because if you say that this is the cause, if you remove that cause, then I'll be able to get pregnant. But to have unexplained infertility, where there is everything is fine,
everything is
I'm
fine,
still not getting pregnant, then it is a worry. Tell me something so that I know that when But in those cases, the good news is that majority of them are still able to achieve pregnancy once we give them treatment. And IVF is one of the treatment that we give, but that is usually at that's usually the last option. Unless, of course, there are other factors that will think that you will have to go in quicker than.
Some people argue that if the man has had, for instance, a child before, it means that he's fertile. You are the fertility expert. Is that true?
Not necessarily. If you have had a chance before, it gives a good record that you can have it again, but it's not absolute. Things do happen in life. There are other things that may happen that you had a child previously, but you may not be able to father a child again. And I don't want to bring this one up, but sometimes our footballer, what is the name?
Is it Odati?
Odati.
Yeah.
Occasionally. It's rare. It's rare, so we don't want to bring it up. But whichever it is important. Once you have a problem, whether you've given before or not, you seek help, and we'll find out where the issues are, and we can help.
So to the men out there who are sending messages saying that they know they are fertile simply because they have previously fathered a child, the Dr. Charles SENAYA is saying it's not cast in stone. Anything can happen at any time. So let's get the right investigations done so that you actually get the right answers. At Patase wants to know that does low sperm quality of an older man affect a child in in reasoning growing up? And so I feel that this is shade at probably somebody that you know whose father is very old.
Not necessarily. It cuts across. There are people who are young, have children who may have some disabilities. So it doesn't, no old age doesn't necessarily do that.
Yeah. And then Nana Echa wants to know that can a couple be infertile after they have given birth before?
Yes. What we call the secondary infertility. Yes, a couple.
So you can have children and then later become infertile.
Exactly. So it goes through the same process. Once you have a child before, you are looking for another pregnancy. It's not coming. You wait a year by 2 years. Then you should see the doctor for assessment. It happens a lot, a significant number of times.
So you wait, let's say a year or two.
Yes. Depending on your age. So usually we put it at 1 year. After 1 year.
Okay. So if after 1 year of having children, you are still trying, like it's not like you're not trying, like you're trying.
Yes.
And you're still not able to achieve pregnancy, like you must talk to like a gynecologist. Okay, about it. What are some of the things that would prevent a woman from ovulating?
So there are a number of things. The commonest one is what we call the PCOS. It's a genetic condition. Or let me put it rather, it's a familial. It runs in families.
Okay.
But there are a number of people that you will see that they don't, their mothers or sisters don't have that problem, but they are not able to ovulate. The main cause we do not know, but what is it is that the ovaries do not produce the eggs every month. So it will take some number of months. Once you don't produce the eggs those months, you will not have the menses. So some people will go 2 months, 3 months. Some people 6 months of the young without menses. Then you realize that they are not ovulating in those months. One of the main factors related to that is obesity. Those who are obese, you realize that when you put on put on, then it can also happen that the menses will not be coming. In other words, you are not ovulating regularly. But now we see people who are also very slim and have the same issue. They are not ovulating and their menses. Yeah. So depending on the woman's body mass index or whether she's obese or not, we are able to recommend treatment options, lifestyle, and also medications to be able to cause the woman to ovulate. There are some other diseases like thyroid disease, those with hyperprolactinemia, the hormones that control breast milk. Sometimes when it goes up, you may not be able to ovulate. All these ones. So once you are not ovulating or missing your menses, when you come to the hospital, we'll do the test, get what might be causing it, and do the appropriate treatment. But one of the important things is also age of the woman.
Age of the woman.
You know, the woman, when they grow, you get to menopause and you stop ovulating and your menses stop. So when you are getting older, towards above the 40s, towards 45, you don't ovulate regularly. And this one also show in a way that you may be skipping your menses.
If you're just tuning in, this is 107.9 Orange FM, and this morning we are talking to the head of the fertility unit at Confanochi Teaching Hospital, Dr. Charles SENAYA, about fertility. If you've got a question to ask him, send it on WhatsApp on 0593 932 993 0593 932 993. It's a very important conversation, and I know lots and lots of people have challenges with fertility. However, help is here today to help you navigate this, murky world of fertility. And sometimes there's a lot of information that you don't even need to hear when it comes to fertility. We'll come to that in a bit. Boss, so couple have come to see the gynecologist. They have been counseled appropriately, or the tests have been done. The process of achieving pregnancy and a baby, how long does it take?
So it depends. If in terms of IVF.
Yes, in terms of IVF.
Basically, give and take, it takes about 6 weeks. 6 weeks for the process.
6 weeks.
Start.
Okay.
After you have done the assessment, and for instance, let's take it that there's a tuber blood kit, and then you decide that you do an IVF. There are various protocols that we use, and those depends on then the age and then the woman's ovarian reserve, or how much eggs reserve that she has in the ovaries. So it can take 3 weeks or up to 6 weeks, depending on the protocol that we want to use. So basically, this is how the process is like. From the time of the menses, generally, a woman will produce or ovulate one egg in a month.
One egg in a month.
Generally, in normal life.
Okay.
But when you are doing IVF, you need a number of eggs. Now, to achieve these eggs, you have to give them medications. It's usually by injection. You take this injection for a number of days. And as you are going through these injections, from time to time, specific times that you'll be advised on, we'll do a scan to see how many eggs that we have in and the sizes. That tells us to modify or appropriately change the dosage until we see that the eggs are mature.
Okay.
Now, this takes roughly 2 weeks.
Okay.
This takes roughly 2 weeks.
Mm-hmm.
Now, when the eggs are ready,
Mm-hmm.
we see it on the scan that they are ready. We go to the theater, through the scan, not like operation by cutting or something, through the scan and a tiny needle, we are able to aspirate, to take the eggs that are developing one from the body. We just go through the vagina to do that.
Will the person be asleep when you're doing
Yes.
that? Okay.
There are 2 ways. Either the person is asleep or we give some injection at the back so that the person will still be awake and can also see what is going on.
Okay.
But more often than not, we let you sleep. And it takes roughly just about 20 minutes.
Okay.
20 minutes. Then we retrieve all these eggs. Now, assuming the person gets about 10 eggs, these eggs are taken to the lab. So it is real time. As you are taking it, we do it in a theater that the lab is just behind you. So as you take it, then you send it to the lab immediately. They will look for the eggs to the lab. Then that is when the sperms will be added. So the day that you are going to theater to retrieve the eggs, that same day your husband will come to produce the sperms.
Okay, the same day that we are retrieving the eggs,
Yes.
that same day your husband will come to produce the sperm.
The sperms.
Okay.
Now, when the sperm is produced, the egg is retrieved. Then the sperm and the egg will be added in the lab. There are various, 2 main ways that we do it. Either the egg is in a special medium and they put the sperm around it and then just incubate it. The next day, one of that sperm will enter the egg. So when you take the eggs today and add the sperm, the next morning when you go and look at it, you realize that a number of them has been fertilized. So let's say you have 10 eggs. You may have about 8 of them being fertilized with the sperm, or 7. Usually about 7, 8 if you have 10. Now, for those who do not have good quality sperm, if you put the sperms around the egg like this and incubate, usually by the next day there will be no fertilization. The sperm will not enter because you need a certain minimum number around it to happen. So in that case, you take one of the good sperms. Look at the microscope, you see all of them moving very fast. You take one good one and under a special equipment, inject that sperm straight into the egg. If you have 10 eggs, then it means that you are going to inject one to fertilize all the eggs that you have. Now, when the eggs are fertilized, so the day you retrieve it and then add the sperm, in 5 days' time, you will see how many of those that are fertilized, how many are still going strong, how many are looking good, how many are of good quality. Then you take 2 of those ones and then you transfer it back into the womb. That is 5 days from the day that you have retrieved the egg and fertilized it.
Okay. So
now,
just a quick one. So if even the man's sperm is not strong,
yes,
we can still.
Yes, you will still be able to do that. Other special equipment, you take just a single one of the good one and inject it into a single egg. So if you have 10 eggs, you need just about 1, 2, 3, 4, 5, up 10, and then you'll be able to do these injections. So those who say that the sperm quality is low, but it is not 0, you'll still be able to find even the ones that the sperms are not moving. There is a way to find out that they are not moving but they are alive.
Okay.
And you'll be able to use those ones to inject, and pregnancy, fertilization can occur and pregnancy can still occur.
Wow.
Now, if you take 2, as I said, sometimes people take 3. In the developed countries where the regulations are there, you can only put back 1 of the pregnancies into the woman's womb. You can't put 2, you cannot put 3.
Mm-hmm.
But in Ghana, we are yet to have our regulation. Most of the time, we put in 2. But our people want to.
People love.
So
Yeah,
much fun.
yeah. People. I don't mind having twins
at all. Once we say that twin is a complication in some places, that people really want it. And because of the amount that they're paying, they want to make sure that if I have 2, then I may not have to go
again. Yeah.
And in the developed countries, most of them, once you meet the criteria, government pays for some of the IVF for you.
Oh.
Yes, up to a certain age, they do pay for you. But
really?
We don't have that. So it makes it a bit dicey but if you put everything together, the complications rate and all this stuff, you realize that if you put in 1, now when you put in 1, the rest that are left, the rest of the embryos, the early pregnancies that are left, the one you fertilize, in 5 days you take 1 to transfer. The ones that are left, we preserve it.
Okay.
We usually say that you freeze it, but it's not in the fridge.
It's not in the fridge.
But we always use the term freezing. You preserve it.
You preserve it. Okay.
Yes. And you can preserve it as long as you want.
Okay.
In the unlikely event that the person is not pregnant, you don't have to go through the process of giving the injections for these 10, 12 days, going to theater to retrieve the eggs, adding the sperm, forming them, because all that stage you've done and have the pregnancy or the embryos there already. You just prepare the woman's womb, and then you thaw the embryo that you have frozen, and then you just transfer into the womb without going through the whole process again. Okay. So if you use about 2 weeks for the stimulation or growing the eggs, and go to theater to pick it, and then in 5 days time you transfer, then you realize that you need about 3 weeks to be able to do that IVF process. Now, after you transfer, there are medications we give to support the pregnancy. In 2 weeks after transferring the embryo or the pregnancy, then you do the pregnancy test.
Okay.
2 weeks after that, you do the pregnancy test. And we'll see whether you are pregnant or not. In the interim, within these 2 weeks, you can still go to work after resting for about a day or 2. Okay. If your work is not so stressful, you are not climbing trees or jumping walls.
Or jumping walls.
But many people will want to just take it easy, rest, which is totally acceptable, and then we give them that chance, even though the evidence is so clear that whether you take it easy, you sleep at one place, or you do your normal house chores, those who get pregnant will get pregnant. But it makes sense. It's logical that people want to rest. And the other thing that people do is that we'll be able to have sex within this. Actually, almost all the people, when you ask, they don't. Even though occasionally, if you do, nothing will happen. Those who get pregnant will get pregnant.
Because people feel that after all that process, it's like you have put like a glass egg
in there.
Inside.
In the olden days, they even have to stay in the hospital for almost the whole time.
The whole time of the IVF?
Of the pregnancy.
Wow.
Once it's IVF pregnancy, they don't want to even cough. So that and now when we transfer, some hospitals will keep them and let them go the next day. But usually, even when you transfer 30 minutes, 1 hour, if you are okay, you just get up and go home. Nothing will happen. It's not like it's going to drop. But if people want to relax for a day or 2,
that's also understandable.
Yes. But those who are traveling outside country, you wonder, because of the stress of all this travel. Look at the Kumasi Accra.
The Kumasi Accra road.
We want them to take it easy, so they want to rest for a while before going.
When that pregnancy is achieved, do they go through the regular antenatal like everybody, or is their pregnancy now handled differently?
So it's a high risk pregnancy.
Mm-hmm.
So the first 3 months it's critical.
Okay.
Critical in a sense that there are some medication we use to support, and it's not every gynecologist who can do that. So
Okay.
usually there will be a special, guidance or attention by a specialist or that special IVF. After that, once everything is fine, they may go to the through the normal antenatal, depending on the individual's risk. Just that we advise they go to a place where the doctor knows what it's about, and they train our specialist gynecologist, so that if there's any issue, it can be picked up early and managed appropriately.
So it's a high risk pregnancy. It needs special attention.
First 3 months, and then beyond that, you can see your gynecologist. There are a number of people who, the distribution of IVF centers is very skewed.
Okay.
Accra,
Yeah. Kumasi.
So there's somebody coming from Noma, so that you want to be. There's a gynecologist there.
Okay.
So that person will go through the antenatal with the gynecologist. It is from time to time you'll be talking to your IVF if there's anything special, especially as I said for the first 3 months. But beyond that, they are able to go through their normal antenatal care, but with a specialist.
If you're just tuning in, this is 107.9 Orange FM, and we're talking this morning about fertility. There are lots and lots and lots and lots of comments. Don't worry, I will get through all of your comments. You can also send yours on 0549 393 2993 05493 932 993.
When you asked, I said that it takes 3 weeks to
3 weeks, yeah.
and a half. But the other side is that if the woman is older in age, and we cannot use her own eggs, or for any reason we cannot use the person's own egg, and we need to get the egg from another person, the hospital arrange that, you will have to synchronize them. So for the first 3 weeks, you will try and then bring the menses to about the same day, and day before you start the process. Okay, so that synchronization, putting them together to align so that you can do the test. So as you are injecting to grow the eggs to pig, we are also giving medications to the woman who will receive the pregnancy, but we are not using her own eggs.
Okay.
We are giving her medication to grow the womb.
You're giving medications to grow the womb.
The womb, yeah, the lining of the womb. The lining of the womb, so that it will be ready to receive the pregnancy. So these putting it together, aligning the one who will give the egg and the one who will receive it, it takes about 3 weeks. And the next 3 weeks, you do the injections for the one from whom you get the eggs, and then you are preparing the womb for the one who will receive it. And that will also take 3 weeks.
Okay.
That's what I say, take 3 to 6 weeks, depending on what you are doing. Yes. But that is just the active part of the lesson. The preparation itself takes longer than that. Yeah.
Someone wants to find out, is there anything to make a man's sperms stronger? And do sperms have categories? I am just reading the questions. My job here is to read the questions. So, are there categorizations for sperms?
So when you do semen analysis.
Mm-hmm.
That is when you be able to capture, I mean, it is normal,
Mm-hmm.
subnormal. And there are various things. We look at the number of sperms within, you look at the shapes, you look at the movements, you put all together, then you'll be able to say that, okay, this one is normal, this one has this problem, and this problem. Things to make the sperm stronger. Generally, in normal life, no, you don't go about or try to make your sperm stronger. What you should rather do is to avoid smoking, cigarettes, taking some drugs that you want to give you more power for sex, and all these ones may affect the quality of the sperm. So you should rather avoid those things. However, if we do the semen analysis and we realize that there is an issue, there's still a problem, there are some supplements that we give.
Mm-hmm.
There are some supplements that we give that, I mean, help those who lack some of those nutrients or elements. So it's not like making it stronger per se, but if you find specific problems, then we would put you on this. But by and large, most of those medications are just supplementary. They don't really move your sperm from 0 to
100
that you want to.
Okay.
So what we're to look at, what can we do with these sperm that we have so that the person can achieve pregnancy?
Okay.
Yes.
Okay. I think usually people are under the conception that if I drink this concoction, if I take this medication, if I chew this root, my sperms are going to be strong. It doesn't do that at all. So, our dear men, you have heard it from the expert. All the things that you are putting in a bottle and pouring, usually alcohol over it for it to brew and all those things, they do absolutely nothing.
Alcohol will make it worse.
It's yes, me can the cheat. Moya na mu share draw na mu share a friend saying Indiani, all sorts of things. Osebema unkwamwa no enya hodin na otimi anyinse oba no. Dr. Penny or Confanocha or She awoso I find fertility no or say sanimani nan and more especially the eye de ensa eshen ensa no can affect its sperms no quality into no and yashe hunye. Someone wants to find out, okay, Nicha wants to find out, can breastfeeding also affect fertility? And she also asks that, can a woman have blocked tubes after she has given birth, for maybe a year or two? You can also send in your WhatsApp on 0593 932 993 0593 932 993. So does breastfeeding affect fertility?
Yes and no. Breastfeeding, usually when you are breastfeeding, there's this hormone that controls breast milk and prolactin. If the levels go high, it can affect ovulation. So when you are breastfeeding, there's a chance that you will not be ovulating.
Okay.
In that case, yes, it may affect, but most of the time, if it's not so high, you could still be able to ovulate and then get pregnant. That's why you see people, they have given birth, they've not weaned their child yet, they are still breastfeeding and they can still achieve pregnancy. Once your menses has returned and is regular, there's always a chance that you can get pregnant.
Okay.
Secondly, about the tube, yes, as we said earlier, someone can have a child and later have a blocked tube.
So, as has been said previously, yes, someone can have a child and later have a blocked tube. Having a child previously does not sort of protect you, if I may use that word, from becoming from having challenges with pregnancy later. So that is something to consider. We'll come to the conversation about surrogacy in a bit, because that is quite a big area for a lot of people. Okay, Abrante, the question you're asking, I will put it to Doc in a bit. That's a different ball game altogether. Okay, he wants to find out if the facilities that accept sperm donations, he wants to ask how much they pay for it. I don't think you should even pay for it. I think you're helping somebody.
Yes, you're right. So there are some jurisdictions, there are some countries that you can't take money for donating sperm. There are others that you take. In Ghana, we don't have the rules or regulation, and everybody who donates, I wouldn't say everybody, there are people who donate for friends who don't take, but otherwise, yes, they donate, take some money. It's not much, but and it differs from clinic to clinic. So when you call a particular clinic or a specific clinic, they will tell you how much they give.
They'll pay you. Do all IVF pregnancies, like the delivery of that baby, should all of those deliveries be by cesarean section, or you can push the baby out?
No, you can push. Once everything is okay, you can push and deliver normally. You can have a vaginal delivery. However, most people are very concerned or careful. The slightest and then the couple themselves may opt for it. And if you see, depending on your judgment and assessment, then you can decide which one will be the best option. But yes, you can have a normal vaginal delivery after IVF pregnancy.
Good morning to you, Soldier. Soldier is asking whether the process of IVF itself is dangerous for the woman.
The process of IVF is usually not dangerous, but with every procedure, there are risks. Every procedure, drinking water, eating food, driving, every procedure there is, and everything in life there's a risk. So in IVF, one of the things that we are careful about or we look out for, which happen very rarely, it is not common, is what we call ovarian hyperstimulation syndrome.
Okay.
There are some people who have a very high reserve of the eggs. So when you give the injections in order to produce egg, as I said, for instance, most people produce between 10 and 15. Somebody can produce many. If you are producing many eggs, then you may have some bloating in your tummy. I mean, there are different grades. Sometimes there can be some small fluid coming in your tummy. But once you are with the expert, there is no problem at all. It is usually handled well. And for those people who they are using their own eggs, you stimulate them, they have that complications. You just pick the eggs, fertilize it, freeze all, treat them, everything goes. In about 2 months, then you prepare the womb, and then you transfer. The other thing is the pain that the women go through in terms of the injection. But it's a very tiny needle. So most of the time, a number of them even like to give the injection themselves.
Okay.
And so it is not much of a problem.
Okay.
And the other one, that is why we usually do it in specialized places. We make sure everything is in place before we do, because you go to theater to pick the eggs. What is important is that at each stage, you are with your fertility specialist. You are with a specialist who knows what to do, how to do it, and usually there's no problem. But yes, you can have ovarian hyperstimulation, which we try to avoid.
Good morning to you. You say that you want to remain anonymous, and he's saying that he and his partner are listening to the show. He says that he went to hospital, and after trying for over 7 years to have a child, and his semen analysis revealed that his sperms were produced dead. Okay, at the time of production of his sperms, they were already incapable of functioning, saying that they have started a process of IVF. However, he is skeptical if he can achieve pregnancy.
As I said earlier, sometimes they all look dead, but there are special tests to see, even though they are not moving.
Okay.
If you are able to do that test, you will be able to have few that you can use to inject and then get the eggs fertilized and achieve pregnancy.
Okay.
Other things that we have to do is to find out why they are all dead. There are some tests that you do. If you are examined by the urologist, that you'll be able to come up with a possible reason why it's happening, and he may have help. Sometimes, depending on the cause, we may have to go straight into the testes to pick some of the egg, the sperms. Yes, from there to use.
I hope you won't be awake when that is being done.
Yes, it's true. Sometimes they give the anesthesia. Sometimes we just give injections around them, and you'll be able to pick. For the ones that, for instance, they are not producing they are producing the sperm, but it's not coming out. With a very tiny needle, you'll be able to get sperms out of the testes easily, and then you can use.
Doc, what are the legal things around using donor eggs and sperms in our part of the world? If for some reason I have a donor egg or donor sperm, can the person come back later and say they come to claim their baby from me?
No, not at all. Not at all. That is why if we are donating gametes, if you are accepting a sperm or an egg, there is a legal form that you sign.
Okay.
Now, generally, there are two ways of getting it. Either from the hospital, so you don't know the source, you don't know where it's
you don't know the
hospital
owner.
Yes, and that is what we usually advise is between you, your husband, hospital, you have your child ready to go. Or you get your relative that, okay, this, I want this to be our family. So I want a gene that comes from my family. I'm going to bring my brother, my sister for the egg, my niece or nephew. But whatever it is, you have to go through counseling, both for the one who is donating and then for the ones you accept. The person knows that it has nothing to do with the child. The owner or the child belongs exclusively to the parents, not the donor. So after going through the counseling and accepting all the terms, you sign a legal document, and you never go back that you are going to look for who the donor is. But there's something interesting that is coming up outside, but we are yet to get there, is that if you have a donor egg or donor sperm and then you give it, should you tell the child?
That's an interesting question.
Yes. Most people will say if you tell the child, you get the child confused. The child will be thinking, so the donor, how would it have been like if I were born by biological parents? How would it, so but studies have shown that usually if you disclose to them, it usually doesn't affect them much, because it is better for you to disclose to them than for someone else to do that.
To tell them.
What is happening abroad now is that people are, the young ones are able to just check if I have any genetic relation with my parent. And if they check and they realize that my father or my dad has no genetic relation with me, then it becomes a problem. And the law outside usually is that when you are more than 18 years, you have the right
To go and
just
check.
go and check with that. So, yeah, there are legal issues that you have to sign all those consent forms. You never have to go back to them. But even if the child gets to know that uh, conception was through donation of a gamete, you know that that child belongs to the parents and that have no other parents anyway.
This is 107.9 Orange FM, and you're on the Orange Health Lounge. The voice you're listening to is that of Dr. Charles SENAYA, Head of Fertility Unit, Confanotti Teaching Hospital, Consultant Obstetrician Gynecologist, and one of the people who taught me how to do a cesarean section. years ago. And today he's here talking to us about fertility. I want to open the phone lines for you now. Call and ask your question. I'm getting a barrage of questions from you. So call now, 0541 022318, 0541 022318. You can choose not to mention your name when you give us a call for the sake of privacy and everything else in between. But that is the that's what we're going to do. So let me pick this call and then